refers to a group of neurodevelopmental disorders involving impairments in social interaction and communication, as well as the presence of repetitive or stereotyped behaviors. The issue I'm going to discuss is the disparity in ASD diagnoses amongst different socioeconomic statuses, which is only one of several issues amongst gaps in healthcare for families who may have a child or children with autism. Higher socioeconomic status is a combination of one's education, income, and occupation, is associated with access to healthcare and earlier diagnoses for youth on the autism spectrum. The importance of early intervention services. The IDEA provides states with federal grants to institute early intervention programs. Any child younger than age 3 who has a developmental delay or a physical or mental condition likely to result in a developmental delay is eligible to receive early intervention services through these programs. The services should address the child's unique needs and should not be limited to what is currently available or customary in your region. Why should children be diagnosed during critical developmental periods? It can help create a roadmap for treatment by identifying the child's specific strengths and challenges and providing useful information about which needs and skills should be targeted for effective intervention. A diagnosis is often required to access autism-specific services through early intervention programs or a local school district. The above chart is from a surveillance-based study showing increasing ASD prevalence associated with increasing SES in a dose-response manner, with a stronger SES gradient ASD prevalence in children with versus without a pre-existing ASD diagnosis. Compared to all 8-year-old children in the study areas, those with ASD were less likely to reside in census block groups classified as poverty areas and more likely to be male and live in block groups with higher adult educational achievement and a higher MHI. Epidemiologists long have suspected that associations between autism and SES are a result of ascertainment bias, on the assumption that as parental education and wealth increase, the chance that a child with autism will receive an accurate diagnosis also increases. I will now show a short video exemplifying this disparity among minority groups.
Autism doesn't discriminate. It's not selective on who it picks.
Black and Latino children are less likely to be diagnosed with autism spectrum disorder than white children, even though research suggests they have the same risk of developing ASD. Because of this, the Centers for Disease Control and Prevention says this likely delays services for non-white children with ASD.
Oftentimes, in communities of color, behaviors are attributed to the need for discipline, and that's not always the case.
Camille Proctor experienced that firsthand when she took her then 2-year-old son, who has ASD, to one of his least favorite department stores.
He was trying to get out of his stroller, and he was just like stiff, and he was falling out. And I remember this lady looking at me who worked for that department store, and she said, "Oh, he just needs his butt." It kind of made me mad. And then, after I processed it and I got all calm, and I'm like, there isn't enough information out there in our community for people to really, really understand, what autism is.
Proctor founded the Color of Autism to help African-American families and families in underserved communities. She hopes education on ASD can address misunderstandings that could be keeping kids with ASD from getting an accurate diagnosis.
You need to have a diagnosis in order to get the services that you need. Families that have children with special needs, period, they go through a great deal of isolation. But if we really embrace that village concept, I think we could have some stronger families in the community overall.
For Newsy, I'm Samantha Crook.
As you can see from the video, diagnosis bias is quite prevalent. Clinicians might be more likely to assign autism diagnoses to case vignettes of children with developmental disabilities if the children's backgrounds were described as higher SES rather than lower SES, according to Durkin and others. Additionally, many insurers refuse to pay for educational strategies such as applied behavior analysis, which is proven to be an effective intervention for youth on the autism spectrum. The role of race and ethnicity is a crucial aspect of SES I must acknowledge. White Americans are diagnosed 1.5 years earlier than ethnic minorities. Minority families tend to teach their children to work interdependently, while majority families teach their children to be socially interactive and independent. There's evidence that when children from traditionally underserved populations do receive an ASD diagnosis, the diagnosis is significantly delayed compared to children identified as Caucasian and from higher SES brackets, with respect to time spent in treatment prior to diagnosis and age. There's also a huge stigma with seeking help among several racial and ethnic communities. The medical model reaction of disability puts the onus on the individual in needing to have all the resources and knowledge and to fight for their needs to be met. A lot of society views ASD in the medical model lens, and this is why so many minority families are discriminated against when trying to receive a diagnosis. Additionally, people may think doctors know best and not have the education or knowledge to ask questions, which is not their fault. The social work model reaction of disability is socially constructed. Discrimination in this context ensures that people are continually disabled. This exemplifies the minority families I've discussed and their lack of ASD diagnoses during a critical time period. Systematic effects and implications for social work. The effects of this are lack of late diagnosis leading to more severe behavioral issues, which can potentially lead to greater stigma, oppression, and bullying. How can we better stabilize and strengthen systems to eliminate diagnosis bias and in turn provide universal access to treatment and intervention measures? Multicultural counseling is imperative for professionals. Becoming advocates for families as they negotiate societal systems and environments is beyond important, as many families do not have access to resources due to not knowing how to navigate the systems set in place. It is important to continue encouraging individuals with and without disabilities to learn about issues surrounding families with autism so we can value those individuals with autism and give them proper diagnoses. To better understand whether minority groups differ from non-minorities in the nature and timing of interactions with professionals related to diagnosis of developmental disruptions associated with ASD, a study is needed that examines child characteristics as close in time to the actual ASD diagnosis as possible. In order to reduce cultural barriers to accessing diagnostic and intervention services among minority children with ASD, and increased awareness amongst clinicians and health educators of diverse cultural practices and biases within families is needed. We need to continue lobbying, working with curriculum developers, educating the public, and providing more culturally sensitive screening and assessment practices. Outreach efforts to minority communities are necessary. We cannot simply sit back and bystand this clear disparity. This is a macro-level issue directly affecting children with autism, as early intervention is imperative for the best developmental outcomes.